Breaking news, a medical first that could change how we think about diabetes forever. Type 1 diabetes has meant a lifetime of insulin injections and strict monitoring. But now, in a groundbreaking case, a woman's diabetes has been reversed thanks to a revolutionary stem cell transplant. Doctors say this extraordinary milestone has the potential to transform the future of diabetes care, offering hope to millions worldwide. Stay tuned as we take a closer look at this remarkable medical breakthrough. I'm now here with Sarah, a medical student at the University of Ottawa. Thank you so much for joining us today, Sarah.
Thanks for having me, Myra.
So I would like to ask you, what exactly are stem cells?
Great question. So stem cells are special cells in our body that have the unique ability to self-renew and differentiate. They're present in almost all of the tissues in our body, and they're crucial for proper development and tissue repair.
Wow, that sounds very interesting. So can you explain what exactly is cell differentiation and self-renewal?
Yeah, absolutely. So self-renewal is a cell's ability to divide many times to produce identical copies of itself. And cell differentiation is a process where stem cells develop into specialized cell types, such as neurons or muscle cells. And you can think of it as a universal seed that can grow into many different kinds of plants. And all it needs is specific environmental cues to trigger that differentiation.
That's a great way to put it. So, is there only one type of stem cell?
So no, there are many different types of stem cells. There's embryonic stem cells, which are found in embryos during early development, and they have the ability to turn into any cell type within the body. There's also adult stem cells. So these are found in bone marrow and skin, and they can differentiate into a certain set of cell types. And finally, there's special stem cells called induced pluripotent stem cells, or iPSCs. And these are programmed to behave like embryonic stem cells, and they're very important. They're a very important area of research because of their ability to differentiate into any cell type of the body.
Great, thank you so much for joining us today. I'm now here with Dr. Gray from Seattle Grace Hospital, who has been treating diabetes with stem cells and has recently had a groundbreaking case. Dr. Gray, could you explain a bit more about the background of your research?
For sure. So, in type 1 diabetes, the cells that normally make insulin are either damaged or lost. So, our idea is to guide stem cells into becoming those missing insulin producing cells called islet cells and then transplant them into our patients' bodies. Typically, scientists differentiate stem cells by exposing them to carefully chosen growth factors to guide them into becoming, for example, pancreatic cells instead of, say, heart or nerve cells. Given that this differentiation process, though, does present some challenges, I specifically use endoderm stem cells in my research. I really picked them, chose them, and loved them, as they're already partly committed to becoming pancreas tissue.
Okay, so could you elaborate a bit more about this groundbreaking case in particular?
In one of my studies, we took a patient's own endoderm stem cells, turned them into islet cells in the lab, and then transplanted them into our patient's liver. Within weeks, we saw that his blood sugar improved, and in fact, by 3 months, he no longer needed any insulin injections. Now it's been over 2 years, and he remains completely insulin independent, with really no signs of tumors or rejection. It's still early days, but these results show that stem cell based therapies could one day free people from daily insulin injections, which really change how we treat diabetes. So McDreamy, right?
Yes, I would certainly say so. Thank you, Dr. Gray, for joining us today, and stay tuned for an exclusive segment with researcher Dr. House coming up next. I'm now back with Dr. House. Thank you for joining us today.
Thank you for having me.
So, stem cell research has made remarkable progress, but I'd just like to ask you, what are some of the main challenges with stem cell research?
So one major point of dispute in stem cell is stem cell procurement. The main source of stem cells as of today are embryos and placental cells. Embryos are currently under moral investigation as to whether or not they deserve moral status. iPSCs could help here because your own cells are actually serving as a substitute.
Okay, so once stem cells are transplanted, what exactly are the risks?
There are risks depending on where the procurement happened. There could be immune rejection, there could be problems with the process of transplantation. But iPSCs could also help here since, again, your own cells are serving as a substitute and rejection is far less likely.
Okay, so what are the next steps?
We still need to learn how to control stem cell behavior, makes therapy safe and reliable, but the future is bright. Recently, iPSCs have been used to generate heart muscle cells for cardiovascular treatment and even in autoimmune disease like lupus, staphylococcus lupus.
Okay, that seems really exciting. Thank you for joining us today, Dr. House. Glad to see your leg is doing better. And thank you for joining us today, and we hope to see you on the next segment.